As we move up through the kinetic chain, let's start to address the muscles that are closer to the lumbo-pelvic hip complex. The first one that I'd like to begin with is the proximal aspect of the adductor magnus. The adductor magnus seems to be aggravated in most people and can restrict articulation of the hip capsule. It's not so good. It's a beat up muscle, but it gets short and tight many times for an underactive and underdeveloped glute medius, especially the posterior fibers of glute medius and a weak glute maximus. So it locks down with the TFL to try to stabilize the iliofemoral joint and the lumbo-pelvic hip complex. This is one of the best ways that I know to release this muscle. I like an exercise bench, or again that 18-inch bariatric treatment table. We're going to go ahead and use this plastic chair right here to do the trick. We're going to use a smaller diameter roll, again one of the roll axers, but you can use any of the other objects like the TheraRoll or any of the other full-side rollers as well. I find starting with the object that's the correct height to be very important. This isn't too bad for me. This is all right. This is maybe a little high, but a touch lower will get me a little bit more about what I want. So the roller you're going to want to start out with perpendicular to your thigh. And as I go to do this, I'm going to be releasing the right adductor magnus, but my shoulders, left hip, left knee, and left toes are all going to be square that way, and then I'll kind of pivot off this area. Understanding your anatomy for the adductor magnus and its origins and insertions can help you begin to relate to the complexity of this muscle. So as you take the roller and get it up towards the ischium, and you start to explore and get closer towards the pumice and the proximal femur, you're going to be addressing different tissues in through here. You want to make sure that your body is adjusted and comfortable. If you can kind of follow my drift, there are certain anatomical considerations that you must take into play with addressing an object being this far up towards the midline of the body and the pubis. And I'll leave it at that, but just understand that you want to make sure that comfort and safety are taken into consideration. All right, so adductor magnus, you're going to start out square this way. Everything's squared off over the right side, and I'm going to move from the roller. I told you I'm going to go left. I'm going to start this way. I'm just going to move through the belly. I'm going to get the proximal aspect of the entire hamstring complex. I'm going to get a little bit of adductor magnus. If you want to come all the way down to the mid-thigh and then get some of the muscle belly of the hamstring complex, that's fine. If you do want to address the mid-belly of the hamstrings and adductors, that's fine. But what we want to do, we're going to get to the proximal aspect of the femur. And once we're up there, I'm going to turn and pivot. Shoulders are square this way, hips are square this way, and I'm going to go from having my femur in this neutral position, and then I'm going to internally rotate this hip. And one thing that you can do is, considering that body as a cylinder, is you can internally rotate an adduct or externally rotate an abduct to address this tissue slightly differently. So you're going to sink in. That roller is wedged up as far as I can. You're dropping all the way down and in. You can add some overpressure if you want, and then once you sink back, you can peel back in this direction. You can get that pull or that drag that the roller is going to allow. The softer rollers may not allow that, but one with some bite or this tacky surface, or using the TheraRoll, which is pretty vicious up in this area, but you can do some good work. You can shift your body weight back in this way and drive the weight down and back into the hips and heels, and I'm getting a corkscrew effect. So as I put weight into the roller here and I'm turning back the other way, hold this femur still. And so I'm taking the roller, I'm pressing my body weight into it, and I'm going to have a different set of pressure and force within the myofascial system. This is a lot more than just going down and back or doing just straight compression. I'm going to get some of that pin and stretch. So you can have the knee straight, slide down and back, adjust your position, but this transfer of weight over here, and just like with my athletes, loading one hip and unloading the other, is going to be key. Even getting up onto the ischial tuberosity and addressing that proximal hamstring complex, that can get you an entirely different layer of results for releasing the posterior and then the medial aspect of the hip, both proximally. All right, that's adductor magnus. I can sit here and roll my adductor magnus all day, but let's walk back to the other setup.